Most of us trust the medications prescribed by our doctors. They're meant to heal, protect, and manage long-term health conditions. But here's the surprising truth. Some of the most commonly used medications may carry hidden risks. Over time, certain drugs can damage cells, alter how your body repairs itself, or even increase your risk of developing cancer. That doesn't mean you should throw away your pills. Many of these medications are life-saving and necessary. But knowing the risks allows you to have better conversations with your doctor, explore alternatives, and make informed decisions. Today, we're counting down 7 common meds that can damage your cells and increase cancer risk. First on our list are proton pump inhibitors, often called PPIs. These include medications like omeprazole, lansoprazole, and esomeprazole, which are widely used to treat acid reflux and heartburn. For short-term relief, they can be very effective, but problems arise when people take them for years without medical supervision. Long-term PPI use has been linked to an increased risk of gastric cancer. A large study published in Gut found that people who use PPIs regularly had more than double the risk of developing stomach cancer compared to those who used less potent acid blockers. Why? PPIs reduce stomach acid, which normally acts as a barrier against harmful bacteria. With less acid, the stomach environment changes, potentially leading to chronic inflammation, DNA damage, and eventually cancer. If you need PPIs, use them only as long as necessary and explore lifestyle changes like eating smaller meals, reducing alcohol, and avoiding late-night snacks, which can help manage reflux naturally. Coming in at number 6 is hormone replacement therapy, or HRT, commonly used to ease menopause symptoms. These medications supply estrogen, sometimes combined with progestin, to reduce hot flashes, night sweats, and bone loss. But studies have shown that long-term HRT use can raise the risk of breast and ovarian cancers. A major analysis published in The Lancet looked at data from over 100,000 women and confirmed that women who used HRT, especially for more than 5 years, had a significantly higher risk of breast cancer compared to those who never used it. The reason is that certain cancers thrive on hormones like estrogen. Extra hormone exposure can stimulate the growth of abnormal cells. Doctors today are more cautious, prescribing HRT at the lowest effective dose for the shortest period possible. For women with severe symptoms, the benefits may still outweigh the risks, but it's essential to discuss individual circumstances with a healthcare professional. At number 5, we have immunosuppressant drugs. These medications are essential for people with autoimmune diseases or those who've undergone organ transplants. Drugs like azathioprine and cyclosporin help calm the immune system so it doesn't attack the body or reject a transplanted organ. But there's a trade-off. A weakened immune system means reduced surveillance against abnormal or precancerous cells. Research has shown that long-term use of these drugs increases the risk of lymphoma and certain skin cancers. A review in the New England Journal of Medicine highlighted that transplant recipients on lifelong immunosuppressants have up to a 100-fold increased risk of some cancers compared to the general population. These medications are life-preserving and often non-negotiable, but regular cancer screenings and strict sun protection are critical for people taking them. It's a reminder of how important monitoring is when a drug affects the immune system. Next on the list are some diabetes medications. Now, not all diabetes drugs carry cancer risks. In fact, metformin, one of the most common, may actually help reduce cancer risk. But other drugs tell a different story. One example is pioglitazone, sold under the brand name Actos. A study published in the BMJ found that long-term use of pioglitazone was associated with an increased risk of bladder cancer. The concern is that the drug may cause chronic irritation in bladder tissue, leading to abnormal cell growth over time. It's important to note that these risks often depend on dosage and duration. Doctors weigh these factors carefully, balancing blood sugar control against potential long-term complications. For patients, the key is not to panic, but to ask questions and ensure you're on the safest option available. Before we move into the top 3, please make sure to hit the like button and subscribe if you find this video helpful. It helps us continue bringing you helpful content on cancer awareness and natural prevention strategies. And now, let's continue the countdown. Number 3, chemotherapy drugs that cause secondary cancers. This one might surprise you. Some chemotherapy drugs, designed to kill cancer cells, can themselves increase the risk of secondary cancers later in life. Alkylating agents like cyclophosphamide work by damaging the DNA of cancer cells, but unfortunately, they can also harm healthy cells. Over time, this DNA damage may trigger blood cancers such as leukemia. According to the American Cancer Society, secondary leukemia is a known but relatively rare side effect of certain chemotherapy treatments. The benefits of chemotherapy usually outweigh the risks. After all, these drugs save lives. But it's a reminder of the complex balance in cancer treatment. Patients who've received these medications are often monitored for years afterward to catch any complications early. Number 2, some blood pressure medications. High blood pressure medications are some of the most commonly prescribed drugs worldwide, but certain types have raised concerns. Hydrochlorothiazide, a widely used diuretic, has been linked to a higher risk of skin cancer. A study in the Journal of the American Academy of Dermatology suggested that long-term use of hydrochlorothiazide makes skin more sensitive to sunlight, increasing the chances of developing squamous cell carcinoma. Another example is certain ARBs, angiotensin receptor blockers, like valsartan, which were recalled in 2018 when batches were found to contain NDMA, a probable human carcinogen. While the contamination issue has largely been resolved, it shows how even commonly trusted medications can come with unexpected risks. If you take blood pressure medication, don't stop suddenly. Instead, talk to your doctor about which options are safest for long-term use. Finally, at number 1, we have antibiotics. These life-saving drugs have transformed medicine, but their overuse may carry long-term risks. Antibiotics don't directly cause cancer, but frequent use can disrupt the gut microbiome, the trillions of bacteria that support immunity, digestion, and cell health. When the microbiome is repeatedly disturbed, harmful bacteria may dominate, leading to inflammation and DNA damage. A large study published in the Journal of the National Cancer Institute found that repeated antibiotic use was linked to increased risks of several cancers, including lung, breast, and colon. The researchers suggested that changes in the microbiome and chronic inflammation could be part of the explanation. The takeaway isn't to avoid antibiotics altogether, they're essential when truly needed. But it's wise to avoid unnecessary prescriptions and support your gut health with fiber-rich foods and probiotics. So there you have it, 7 common medications that, while often necessary, may damage cells or raise cancer risk when used long-term. The key is balance. Never stop taking a prescribed drug without speaking to your doctor. Instead, use this knowledge to ask better questions, weigh the benefits against the risks, and explore alternatives where appropriate. Which of these medications surprised you the most? Let us know in the comments. We'd love to hear your thoughts, and if you want to keep learning, don't miss our video on 8 worst foods that can cause bladder cancer. It's eye-opening and could help you make even better food choices. If you found this video helpful, don't forget to give it a thumbs up, share it with a friend, and subscribe for more natural health and cancer prevention tips. And if you'd like to support the channel, check out our merch or use the Super Thanks button to help us keep creating content that empowers and informs. Every bit of support means the world to us. Thanks for watching, and as always, have a healthy and happy day.